Hello and greetings from Texas Healthcare Trustees. My name is Susanna Ramshaw and I oversee trustee programs and engagement for THT. I am pleased to present our inaugural episode of Learning Legislation with Cesar Lopez, our Associate General Counsel of the Texas Hospital Association. This series of bite-sized education is a monthly summary of insights from the 87th Texas State Legislature, and Cesar will provide some takeaways for board members and hospital leaders from proposals, bills, and other actions at the state capitol. He'll also share some THA resources that can help you and your hospital stay up to date on current events. So I'm just going to hand it over to Cesar right now, and he'll provide you all an overview of the state legislature and give us an idea of what to expect this session. So take it away, Cesar, and thanks again for your willingness to do this.
No, happy to be here, Susanna. Good to be with everybody. I know we've done a lot of these presentations over the years. I've been at THA over four and a half years now, so likely met with some of you viewers in person, and if not, again, once we get back to sort of normal, we're always happy to come out to your neck of the woods, your facility, meet with you and your team and kind of work through any of these issues, whether it's general legislation or more specific issues that we at THA might be dealing with. So again, like Susanna noted, these are intended to be sort of high level, quick bites, quick updates on what's happening during the legislative session. The legislative session here in Texas, for those of you that aren't too familiar with it, takes place every odd number year, every other year. So our session kicked off in January of this year, 2021. It'll run through May of this year, 2021. And then if there's any sort of special sessions that are called, those will sort of play out post May 2021. So again, the legislature just meets once every 2 years. And I'll note this a little later. The only thing the legislature must do, constitutionally must do every year, is pass a balanced budget. And we'll get to that in a couple of slides. So like Susanna mentioned, we have a number of tools and ways for you to keep up to speed on what we're doing over here at THA, or maybe even what we're doing over at the Capitol. One of the sort of coolest things I think that we've done in the last couple of years is create this legislative session app. It's on the App Store, the Google Play Store. It's pretty easy to find. Just go in and search for THA legislative app. You should be able to pull it up and download it fairly easily. And it's really convenient for all you guys. We push everything that we can through that app. So there's white papers, one-pagers, explainers, sort of all of the above goes through that app. You can kind of keep track of your bills. And I think there's even now an option for you guys to reach out to your legislative representatives on issues as need be. So again, we're always constantly updating this app, improving this app. It's really evolved into something really, really useful. So again, I would encourage you guys, if you're interested, to download this app, use it as sort of your entry point to all things THA over the coming months. And then again, like I'll keep mentioning over this presentation, if you guys have any specific questions or any specific issues you guys want to get into, feel free to reach out to us. We'll do everything we can to help you or get you to somebody that can help you if we cannot. So again, try to go ahead and download that app. And the next slide that I want to get into, and again, this is a slide that really plays better in person, as you can imagine, but it's something that I've been using for years whenever I do these sort of intro to legislation talks. And I don't take credit for these. These are a set of slides that have been floating around THA for years now. But basically, the idea here is, we've all been conditioned from childhood that the legislative process is something that can be boiled down into a really catchy 2-minute jingle. Now, I'm not going to play the video for you guys, but you all remember this Schoolhouse Rocks short that we've all seen and all hopefully love. But in reality, at least in Texas, the legislative process is much more complex. And so this slide, again, is an overly simplified sort of a breakdown of how a bill makes it through the legislative process here in Texas, the Capitol here in Texas, all the way to becoming signed into actual law. Now, I'll try to run through this here pretty quickly. But in essence, a bill has to work its way through both sides of the Capitol. It can start in the House, work its way through the House, go through the Senate, work its way through the Senate, or it can start in the Senate, work its way through the Senate, go to the House, work its way through the House, until it becomes a final agreed to bill, and then it's sent to the governor's desk for execution. Now, for sake of simplicity and kind of following this chart, the snake here, let's assume that a bill is introduced on the House side of the Capitol. That's the blue part of the snake at the top there. A bill has to be introduced. It has to be sent to a committee within that respective body. So again, here we're talking about the House. For those of you that are unfamiliar with what committees at the Capitol are, they're basically subsets of each respective legislative body. So the House of Representatives here in Texas has about 150 members, I believe. The committees are composed of about 10 to 12 or so members. So, that 150, they're distilled down into separate committees, and then each committee will be responsible for hearing a certain subset of bills. So all the healthcare bills, in theory, should go to the same committee, whatever committee that is determined to be. So a bill is introduced, again, in the House. It's sent to that specific House committee. It has to go through multiple public hearings within that committee. So that committee will meet, or I guess should meet in theory during sort of a normal session, at least once a week, maybe multiple times a week. They'll post those bills for hearing. They'll hold a hearing. Again, it's a public hearing. They will invite folks to come and testify. The public can come and testify, so forth and so on. And so that bill is essentially heard multiple times in that respective committee. At the end of that hearing process, that bill has to be voted out of that committee. And so once that bill is voted out of that committee, it goes to the floor, in this case, the House floor, and has to be put up for debate in front of the entire House. So and you had maybe 12 or so committee members and the public debating and considering that bill while it was in committee. Now it goes to the full floor, and all 150 members of the House have a chance to hear about this bill, what it does, and really debate on that bill. Ultimately, if a bill makes it through that floor process, it's going to be voted on by all the members. And if the vote is for the bill and majority vote for that bill, that bill is now sent from the House over to the Senate side. Or again, if the bill started in the Senate, over to the House side. Once it gets to the other side of the Capitol, in this case the Senate side, you go through that whole process all over again. So it's sent to the respective Senate committee. Again, the Senate committees are a subset of the 31 or so Senate members. You've got to have your public hearings. There's the opportunity to testify on any specific bill. Has to be voted out by majority, sent to the Senate floor, again, publicly read in front of the entire Senate at this point, and then voted on again. Majority vote keeps the bill moving at all these sort of junctures. Assuming the bill goes through sort of unscathed, so to speak, it's sent to the governor's desk. The governor can either sign it or veto the bill, or I guess if he doesn't sign the bill, it passes, it becomes law anyway. But as long as he doesn't veto it, you're good. If the bill gets changed at any point in that process between the House or the Senate and the House, both sides have to appoint representatives. They come in and negotiate the differences in the bills and try to reconcile any differences any changes to the bill that were made during any of those committee or floor readings. And so again, it can get really, really complex. You could easily spend probably an hour or more just kind of going through all the nuances. But again, hopefully I didn't lose you guys on that. Again, the point is that this process is incredibly, incredibly complicated. This chart here that you have in front of you is sort of an easier way, hopefully, to digest all that. But again, it's a lot more than you guys might realize if you don't really pay attention to these things. So, Suzanne, I don't know, any questions you might have on any of that, or you think that the viewers watching might have?
I already feel overwhelmed, so
yeah.
Let's keep plugging along and see. Let's see what the 87th session has in store for us.
Yeah, so again, hopefully for those of you that I haven't lost yet, we'll try to kick into some more specifics here. So the big question is, what is this session going to look like? In reality, I don't know that we really know at this point. Certainly COVID is still going to have a lingering effect on whatever session looks like. As I mentioned, during a normal session, the Capitol would generally be full of legislators, staffers, lobbyists, attorneys like myself over there, talking to folks, meeting on different issues, working through different bills with legislative offices or other stakeholders. But really, for example, I haven't been to the Capitol yet. I mean, session's been going for about a month now. I haven't been in the Capitol once. We have had some meetings with legislators over the past couple of weeks. Those have all been via Zoom or Teams or virtual, one way or another. And so, nobody really knows what this session is going to look like. I think the general assumption is that it's going to be sort of a depressed session, if you will. There probably aren't going to be as many bills that are ultimately passed as would be in a normal session. Now, for example, there's some information here on this slide. Back in 2019, which was our prior session, there was about 7,500 bills filed during the whole 140 days of session. Generally, about 20% of those bills will actually pass into law. But again, what are we going to see this year? Who knows? We've seen probably over 1,000, over 1,500 bills filed at this point. Again, first couple of weeks of February. What's that total going to look like in May? By May, who knows? How many of those bills are actually going to be able to pass? Who knows? How are hearings? I just mentioned committee hearings and sort of floor debates. How are those going to play out? Are the members going to be okay with bringing, allowing members of the public to come into the Capitol and testify on these bills? Are they going to be comfortable having, these rooms full of individuals for these hearings? And really, at times for some of these hearings, those rooms can get pretty full, pretty cramped. So, if somebody does have a concern about COVID-19 or contracting the disease, there would definitely be some hesitation in holding sort of a normal hearing as you would during a regular session. So again, we really don't know at this point. Hopefully by next month, I'll have more information on how sort of the rules will be set and those hearings and other issues will play out. But as of right now, we really don't know. I can just tell you that it has been slower than normal. So more to come on that. The next issue that I'd like to get into very briefly is the proposed budget for the coming biennium. So again, for those of you unfamiliar with how the state budget works, as I mentioned at the start of the presentation, the legislature by law is constitutionally required to pass a balanced budget every session. That budget is for I guess the coming biennium. So in this year, 2021, they will pass a budget for the 2022-2023 fiscal year, 2022-2023 biennium. In 2019, they passed a budget for the 2020-2021 biennium. So we haven't really played out the entirety of that prior budget that was passed in 2019, and we're now working on the proposed budget, or what will be the budget for the coming 2 years. So a couple of things are, again, really affected by the COVID pandemic. About 6 months or so, the comptroller indicated that there would be a shortfall, both for the current budget, the 2021 budget, and then the proposed 22-23 budgets. When the final estimates were released a couple of weeks ago in January, the good news is that the expected shortfall wasn't as bad as originally expected, maybe 6 or 8 months ago. So for the coming budget, the budget that the folks will work on this year for 22-23, there's approximately $112.5 billion in the estimated budget. Again, that was expected to be much worse than that current estimate. And in reality, that $112.5 billion is about 0.4% of what the legislature had, 0.4% less than what the legislature had to work with in 2019. So it was a hit, but not that big of a hit. The legislature had about $113 billion in 2019 to work with. And again, because we're still in that current budget for 2021, there's also expected to be a shortfall for that current budget. It was expected initially to be about $4 to $5 billion, but it looks like it's going to be closer to about a $1 billion shortfall, which again is really good news, all things considered, where we were 6 or 8 months ago. So the final numbers, of course, are to be determined, but again, good news as far as that shortfall and what folks were expecting. The state likes to remind folks that we have this rainy day fund that's been set up in place for decades now. That's got approximately $11 billion in there. I have on here noted about 10 billion, but it's actually probably more like 11.5 billion. Again, one thing that I want to highlight for everybody is that the governor ordered statewide budget cuts in the middle of last year. He asked all state agencies to enact a 5% across the board budget cut. So that almost certainly helped with these sort of improved shortfall numbers that we're talking about now. So again, what those final numbers look like, we'll know soon. But one thing that we can tell you is that both the Senate and the House have released their initial proposed budgets, and both of them look pretty similar, at least when it comes to healthcare. And so they both clock in at about 119, just under 120 billion dollars. Now, you'll note that that's more than the 112 and a half that they're expected to have to work with, and that's a normal phenomenon. I mean, they usually come in higher on their proposed budget than what we think we're going to have. So basically what's going to happen over the next couple of months is there's going to be discussions back and forth. Do we make cuts to that $119 billion number? Do we pull from the rainy day fund to kind of make up the gap? And so we need to try to find the sweet spot in between what's proposed and what will actually pass at the end of the day. So again, these are all sort of initial first blush numbers. We're going to get much more detail and much more clarity on this in the coming weeks. And again, we will update you guys as we learn more. But what we can tell you is, again, just kind of highlighted here on the slide, as laid out in those initial proposed budgets, the funding for Medicaid, women's health programs, Texas AIM, other payment mechanisms for hospitals remains about the same as what we saw in 2019. And so we, at least initially, are pretty happy with what that looks like. But again, we'll see what sort of plays out in the next couple of weeks here, next couple of months here. And then I think the final slide that we have here is just want to highlight a couple of buckets of issues that we're starting to see sort of pop up over at the Capitol. Bills, like I mentioned, have already started to be filed. We've seen well over 1,000 bills filed. We're tracking every bill that we think has anything to do with healthcare or hospitals. I can tell you guys that back in 2019, we tracked over 1,000 bills, probably close to 2,000 bills. And we have to actively go in and work, bills probably in the hundreds every session. Again, what that looks like this year is to be seen, but we're starting to see some trends pop up. The first sort of bucket of issues that we're seeing has to do with hospital visitations. And again, this is an offshoot of the COVID pandemic and some of those visitation rules that the state promulgated back in the April timeframe. I'm sure everybody watching has had to deal with these issues over the last year. Inpatients being denied visitors or having limited visitors over the last year. There's all sorts of let's call them horror stories coming out of the Capitol with members relaying stories from their constituents that a constituent maybe wasn't able to visit their child in the hospital, or a loved one was seriously ill or maybe even passed away in the hospital without the ability to receive visitors. And again, that was just a byproduct of the pandemic and those rules that were handed down from the state kind of early on in that process. And so, again, we're trying to find the balance on what we can do as far as allowing visitors, but at the same time trying to prevent the spread of any sort of infectious disease or something that would cause a serious community health risk. Again, we're not necessarily talking about COVID-19, although of course that is a current concern, but we're talking about something more like another Ebola scenario or something like that, where there really is going to be a clear medical need to isolate a patient and make sure that that infectious disease, that infectious agent, doesn't spread from that patient to the community at whole. So again, there's a number of bills out there on visitation, proposed bills out there on visitation, everything from every inpatient must be guaranteed at least one visitor at any time, pandemic or not, to guaranteeing access for inpatients to clergy. Again, you have these end-of-life issues where somebody might request a member of the clergy come and visit them if that patient may be in kind of a dire situation. So again, there's bills out there that would guarantee that access. But again, we're managing all of those, we're monitoring all of those, and we'll try to do the best we can with all those bills. The second bullet point that I want to get into here deals with liability protection. And this is another issue that we at THA have been engaged on really since March, since the pandemic kicked off. And we noticed there were some gaps in the state law related to liability protection for providers responding to disasters and emergencies. There was a bill that was passed in the wake of Hurricane Harvey that would provide liability protection for volunteer healthcare providers. So that's somebody that comes in to the hospital, responds to a disaster. Again, might be a hurricane, might be an earthquake, might be a fire, might be a pandemic, whatever it may be, but comes in to provide that assistance without expectation of compensation. So if somebody comes in, let's say a retired nurse, retired physician, comes in and starts to provide some assistance to the facility, as long as they're not paid under current law, they will receive some level of liability protection for that care that they're provided. What we saw at the inception of the COVID pandemic is that doctors were sort of playing out of their element. You might have surgeons that were being called in to come help staff an overwhelmed emergency department, and so a surgeon who maybe hasn't seen the inside of an ED since maybe residency is now being asked to come in and provide this high level of care that they're maybe not used to providing. And so the concern there was, of course, well, let's just make sure that we can provide some liability protection for those individuals in a similar situation. Now, we're not asking, and never did ask for, just kind of wholesale, broad-based liability protection, but basically just a slightly enhanced amount of protection that would protect them in case something happened, again, in an area of the hospital, an area of the facility that they're not really used to practicing in. So we at THA, in conjunction with our normal partners like the folks at TMA and others, sent a letter to the governor asking for some of this liability protection, again, back in about April. We never really caught any traction with that. And so the focus on that eventually turned to working with Senator Cornyn on a liability bill that was actually drafted up sort of at the end of the summer, beginning of fall, and kind of bounced around at the federal level for a while. And we thought maybe would be a part of one of these COVID relief packages that passed sort of at the end of last year. Ultimately, it wasn't, and so we don't yet have that liability protection either at the state or the federal level. But we, after sort of that exercise with Senator Cornyn, turned our attention back to the state level, and are now working on a pretty broad liability protection bill at the state level, again, with folks at TMA and other areas of industry, not necessarily related to healthcare, but that would provide some pretty good liability protection for healthcare providers, healthcare facilities, and other sort of businesses out there in the state that are dealing with the COVID pandemic restrictions and the like. So it looks like this bill will catch some traction during the session. We are very actively engaged in this bill. And again, hopefully we'll have some more information on this in the coming months. Hopefully we'll be able to report out by May that this bill did pass and that we can check it off as a win for the session. But again, more to come, and any questions, just let us know. The third bullet point has to do with this issue of paid or incurred. Now, this is more of a sort of niche, specialized issue for some of you folks, but this really has to do with issues related to medical billing, medical charges, excuse me, as related to personal injury cases. So you have this sort of phenomena out there where somebody is involved in, let's say, an automobile accident. They're brought into the hospital provides, all the care that the patient needs to stabilize and treat them as a result of that automobile accident. But then that patient, leaves the hospital, goes out, hires a lawyer, and sues, the party that caused the automobile accident. And then all of a sudden, the hospital, the physicians, the providers are sort of embroiled in this issue over what is a fair and reasonable cost for those healthcare services provided. And again, the distinction there is we bill a certain amount, but the allegation is that the hospital will ultimately accept a lower amount than that full billed amount for those services provided. And so the fight is really over, what that reasonable amount really is between the full bill charge and the amount that the hospital will actually allegedly ultimately accept. Now, again, this is another issue we could easily spend probably a full hour on, but just know that there is a bill out there that has been introduced, and actually I can give you a bill number if you guys are so inclined to go look it up. It's Senate Bill 207, SB 207, that tries to get to some of these issues and try to get to some of those issues of reasonableness over hospital charges and hospital payments, rather not just hospital, but all healthcare charges and payments. Again, we do have some concerns about this. We've seen a trend over the years where these issues continue to pop up for our hospital members, really cause our members to have to engage in a litigation discovery process, spend a whole bunch of time and money responding to these discovery requests, and ultimately just sort of causes a ton of headaches and really work for our hospitals that get involved in these cases. So again, what we're trying to do is make sure that we can protect the ability for the hospital to collect as much as we possibly can for providing care to these individuals that are injured, these personal injury patients, while also reducing the amount of discovery and work that a hospital might have to do, and also protecting some of those proprietary billing information documents, contracts with third-party payers, insurance carriers, really protecting the charge master at the end of the day and making sure that we don't have to turn that over, which we really shouldn't have to, but just codifying that in law, things of that nature. So again, this is an issue that we've been dealing with for several years now. We will continue to engage on this. This is looking like it's going to be a big issue this session. And so again, more to come on this. Any questions, let us know. Happy to talk with you offline on that specific issue. The last issue that I want to bring you guys this month, again, just has to do with the general ability for the governor to issue executive orders. Now, again, we saw what played out in the state over the last year or so with the governor issuing executive orders, restricting access to businesses, mask mandates, et cetera. Certainly everybody's entitled to their own opinion as to whether or not those executive orders were appropriate or overreach or whatever it may be. But there was clearly a lot of disagreement over what the governor did over these past months. And so there's a lot of bills out there that attempt to give the legislature a lot more oversight on the governor's ability to issue these executive orders. I mean, it's everything from the governor's executive order can last no longer than 30 days to anytime the governor issues an order that restricts businesses or access to businesses or whatever, the legislature has to be called into session to review, to giving the courts oversight over executive orders, meaning anybody could essentially sue the governor, I guess, anytime an executive order is issued, to the legislature creating an oversight board, so to speak, that would have ongoing authority to review, amend, and I guess even repeal an executive order that the governor may issue. So again, a lot of debate over whether what the governor did this past year was appropriate and really necessary. And so you're going to see those issues play out again over the next couple of months. Kind of interesting to watch. We obviously are going to be monitoring those as well, because a lot of what we were able to do in response to COVID came as a result of those executive orders. So there was a lot of waivers that exist because of those executive orders. And so we certainly have an interest in making sure that those orders provide as much benefit to our members as possible. So again, I just kind of ran through a lot there, Susanna. Hopefully I didn't lose anybody over the last 10 minutes or so. But again, hopefully this information is useful. Again, if you guys have any questions, reach out to either of us, either Susanna or myself. We're happy to discuss further and in more specificity. But again, thank you so much for having me. Hopefully, these are beneficial and we'll be able to provide much more information in the coming months.
Yeah, thank you, Cesar. Such a wealth of information. And it sounds like, even because of COVID or due to COVID, there are some silver linings that we're seeing already, whether it's a smaller budget shortfall than anticipated or, decent budgets for healthcare programs, prioritizing those, of course. So a lot of great things to keep tabs on. I think one question I have is, you gave us the sort of full life cycle of how a bill becomes a law, but what's the general time frame? So if we're following, SB 207, and maybe it's introduced last week, when can we expect it to maybe be signed into law?
Great question. And actually I get that question fairly often. Folks will ask, well, what's the quickest a bill can make its way through the process and be signed into law? I really don't know. It's sort of a byproduct of how quickly those committees meet, how quickly the bill is sent to the respective floors, heard, et cetera. There's a lot of potential pitfalls along the way. So if a committee decides that we don't want to hear this bill, it never gets a hearing date, then it doesn't have a chance to make it to committee. It's basically DOA.
Squashed,
so
right.
There's a lot of those sort of pitfalls along the way. There's certain deadlines sort of in the April-May timeframe that if a bill doesn't make it out of committee by this date, it's effectively dead. If it doesn't make it off the floor by this date, it's effectively dead. And so really, in a lot of ways, those deadlines are more important to us than the last day of session. If I had to guess, I would say maybe the quickest, if sort of the stars are all aligned and everything works perfectly, the quickest a bill could probably make its way through both sides of the Capitol, get all the hearings, all the readings, all the votes in, probably about a month. Again, don't hold me to that, but that's probably my best guess.
No,
but again, I'll highlight this for everybody watching. Those committee assignments just came out in the last week. So we're already a month in a session, and really nothing really happens until the end of February, beginning of March. So even if a bill is introduced on day one, and this is not unusual. I mean, committee assignments really aren't made until weeks after session kicks off. So, I can't imagine that there's a scenario where a bill, at least in modern times, would be introduced on day one, have hearings starting on day two, and kind of be off to the races that way. Again, it just sort of, there's a lag at the beginning of session, and things don't really heat up until March and April, those timeframes.
Sure.
So you'll start to see, these updates will be much richer and have a lot more information, kind of in March and April and May. And we'll probably start to see a lot more activity at the Capitol. Again, what that looks like compared to a regular session, who knows, but we'll certainly see more activity around the March, April timeframe, and we'll start to see some of those bills move or die or not move or whatever. So yeah, I would say a month at best, but it usually takes longer than
probably
that.
Longer. Yeah. All right, now, final question. I'm not sure if you're a gambling man, but would you put money on having a special session this year?
So the big issue this year is going to be redistricting, excuse me. Again, for those of you who aren't really following at home, the general belief here is that the census data was delayed because of COVID. We're not expected to get that till probably the beginning of summer, who knows. So I would absolutely bet that there's going to be a special session later this year, if nothing else, to tackle redistricting. Again, when the governor calls a special session, he gets to decide what's on the agenda, so to speak, for any special session. He could decide that he wants to have healthcare issues on there.
Sure.
Who knows? But I would absolutely expect there to be at least one special session dealing with redistricting. And maybe that's another issue we can get into kind of in April or May and talk about how those special sessions work. But yeah, I would expect at least one.
Super. All right. Well, thank you so much for your time today. And for those of you tuning in, Cesar and I will be back at this next month and have that available for you on our website, which is tht.org/learning legislation. Thanks for your time, Cesar.
Yeah, thank you. Thanks for having me.